The coronavirus pandemic is expanding rapidly within larger, lower income or lower middle income countries such as India and Nigeria. Imperial College researchers say a range of health inequities means some groups are at far greater risk.
So from just three factors alone, that is the availability of hand washing facilities, an ability to work from home, and hospital access, we estimated on average a 32% increase in the probability of death from COVID-19 when comparing individuals from the poorest households to those in the wealthiest households, with the key driver really being lack of access to hospital and ICU beds.
Poorer families also tend to live in larger, multi-generational households, hampering efforts to protect elderly family members through social distancing. Other indirect effects of the pandemic also have a disproportionate impact.
There is an overlap in the potential timing of lockdowns in these areas with key planting and harvesting seasons for staple crops. And we also know from the data that individuals in poorer households in these areas also depend more on food grown themselves, so there are serious food security issues.
Health checkups for other diseases are also being severely impacted by COVID-19.
HIV, TB and malaria-related deaths over the next 5 years in high-burden settings may be increased by up to 10, 20 and 36% respectively.
The report's authors say existing patterns of inequality mean the poorest are less able to protect themselves from infection. They urge governments to focus on improving access to hand washing and strengthening community health services. Henry Ridgewell for VOA News, London.